Steve Adubato here. We are Uncut with Phil Alagia, who is the Chief of Staff in Essex County, New Jersey, and also Maya Lordo, who is Health Officer in Essex County. Good to see both of you.
Good to see you, Steve.
Phil, let's put this in context. We're taping on the 2nd of September. It'll be seen later, not only on YouTube, Twitter, Instagram, on our website, steveadubato.org, and also Spotify, Apple Podcasts, and incorporated into our public broadcasting programming. Phil, put this in context on the 2nd of September. Essex County has a comprehensive COVID plan. What are the keys to it?
Well, I think absolutely. Right now, it's about testing. I mean, under Maya's leadership, we are testing, upwards of 1,000 to 1,500 county residents a week. Free testing, no insurance. We go from every corner of the county. We've hit every municipality. We're now working on every municipality twice. So I think right now, and I'm sure Maya will attest to it, testing and knowing whether you're positive, negative, is very important to limit exposure. Whether you have symptoms, don't have symptoms. An exciting thing we just added is now we're going to test children as young as 8 years old, because we think it's very important as they're headed back to school that their parents and their families can get a clearer understanding of where they stand.
And let me share this. We disclose all kinds of things we need to disclose, and I will disclose this, that about a month or so ago, my wife and I, together with our 2 older children, not our daughter who's turning 10 as we do this program, but all 4 of us went to one of the Essex County sites, I believe in Bloomfield. And it was the first saliva test that we took, and I'm sure Maya's going to talk about that. And we also got the results back in a couple of days, which is exceptional and extraordinary and necessary. Maya, talk about why the saliva test?
So there's 2 types of testing. We have our nasopharyngeal, and then those are the ones that go up the nose, and the saliva testing. The saliva testing makes it a little bit easier for those individuals that might be a little bit uncomfortable. Also, saliva testing allows for us to not use as much protective equipment or PPE because we don't need clinical staff to actually do the nasopharyngeal swab. So that allows for the saliva test to be more of a self-administered test.
Got it. Phil, let me ask you this. When we were actually going through the testing, I saw the county executive was there, Joe DiVincenzo. Actively engaged and involved, the county executive, in not only the overall COVID plan for the county, but on the testing process. As usual, Joe D, very actively engaged. Fair?
Listen, from every level of government, we've been aggressive in trying to do stuff for COVID. Every Thursday, we distribute 40,000 meals, 1,000 boxes with 40 meals in it to people in Essex County. Residents. It's a drive-through site. If you ever want to know where to go to our website.
Say it, Phil, so we'll put it up on the screen as you talk about it. What is the website?
EssexCounty.org. And
EssexCounty.org. Go ahead.
Correct. And we will, we've been giving food out. We've been doing testing. We're about to come up with a rental assistance program. We've given $10 million to small businesses in Essex County that have struggled during COVID through the NJEDA. So wherever we can help
Economic Development Authority, correct?
Correct. Wherever we can help residents in Essex County, we've tried to be there. We've been very transparent and open in getting information out to all the elected officials, particularly in March and April and May when people didn't know what was happening. We were communicating. We had daily calls with the mayors, and Joe and the staff here really stepped up to the plate. Maya is our county health officer. She just started about a year ago, and she's, thank God we have her because she came at the right time, and she's really done an unbelievable job leading this effort in Essex.
Maya, let me follow up on what Phil is saying right now. Phil's saying about children as young as 8. Whether it's our daughter or anyone else, and Phil has young children as well in that range, and a little bit older as well. But talk about the importance of testing of young children, particularly as it relates to being in school potentially, at least some of the time if the hybrid situation. Talk about that, Maya.
So as our schools do decide going forward whether they're going to go from a hybrid or they're going to open up all the way, I think we need to give the opportunity to our communities to test our younger children. Our younger children we know are the ones that are asymptomatic. They're the ones that may carry the disease, but yet do not show any symptoms. So if, let's say, somebody was going to go ahead and go see their grandparents or somebody who's immunocompromised, it's so important to go ahead and test your child to be able to not get those individuals who might be immunocompromised at risk. It also gives the opportunity for us to, if you went away somewhere or you were in a large crowd with your child, giving the opportunity, go ahead, get your child tested. If they get tested, you can be comfortable with having them return to school and having the school environment be safe.
Everything we're talking about, and Phil is talking about some of the initiatives outside of the testing, which has been really important and impressive, and we'll put up the website again, essexcounty.org, correct, Phil?
I'm gonna make sure, but yes.
Okay, we'll make sure it's right. But here's what I'm going to get at, Phil. There's an economic and a fiscal impact here. Talk about, as we do this program, about 6 months in of the COVID crisis, how devastating has the fiscal and economic impact been to Essex County?
I mean, I think we are in a unique position because we have a big fund balance. We always talked for years about building up your fund balance for a rainy day and, squirreling away money, and it's really come through fruition. I mean, think about all the revenue that governments have lost. There's going to be, municipalities that have, think about the hotel tax in Newark or the parking taxes that they get revenue from. For months, no one was in hotels and no one was parking in Newark and around the municipality. So all that revenue gets lost. On the county level, all the revenue we bring into the parks department through,
golfing at the free golf courses, like that didn't happen for a long time.
Correct. So all that revenue, you have to make up. It was in the budget and we have to make up. We're worried now as we approach the third quarter, when taxes are due, when taxpayers are due, if we had such a high unemployment rate, are there going to be a much lower collection of local taxes to the municipalities, which will make it difficult for the municipalities to pay their county taxes. So, we've gotten CARES dollars from the federal government, which enabled us to do a lot of the COVID stuff that we're doing. But the CARES dollars doesn't allow us to make up for lost revenues. And there's talking now in the federal government to help local governments do that. But, I think this is something for a long time. State income taxes, the state budget came out on September 1st, and there's a lot of cuts in that budget that are due to the lack of revenue. So I think
and some of that money goes to county government, initiatives on the county level for nonprofits that both you and I know very well, Phil. There are all kinds of cuts that are being made because Governor Murphy and the legislature are faced with extraordinarily difficult choises.
20% unemployment rate. That means, 20% of income tax.
Less income tax. Collected. And by the way, Phil, the magic of technology, our producers have in the Zoom chat. It says it's EssexCountyNJ.org. Thank you, Erica and Michaela. So, Phil, that's okay. Listen, that's all good. Before I let you go, Maya, let me ask you this. As the health officer, one of the things that I'm sure you're aware of and concerned about, as we are as well, but you're different because you know more than we do, is a lot of the misinformation about there, a lot of the confusion about what's safe, what's not safe, where we are at vaccines, whether the FDA is going to move too quickly on them, et cetera, et cetera. What's the best advice you have for people on trying to manage and navigate the flood of information that's often, trust me, there's a question here, contradictory and confusing?
I think we need to take a look, and information is really the only thing we have right now to get us to guide us in what we're going to do from our day-to-day. Are we going to send our kids back to school? What are we going to do? I think the biggest thing that we need to do is we need to make sure that we understand what our community is doing and look at the resources that are being offered within our community. So I think going to the county webpage and looking at what's available should be where we should start first. I also think using the information coming from your local health department is really important. Going to your local health department, yes, And we have seen some very interesting guidance coming out of CDC lately regarding testing. I think going to our local health officers, to our local elected officials, and asking for the information and the resources that are available locally, I think that's where really we need to focus.
Steve,
Well
the
said,
one
Maya,
thing,
because I'm sorry for interrupting, because so much focus has been on what the president says or what members of Congress say or what, we all follow Dr. Fauci or Dr. Birx, et cetera, et cetera. But locally, I mean, Phil understands this better than most, that municipal government, county government, state government, the government that's closest to people often is the level of government that has the greatest impact on people. So I want to thank Phil and Maya for joining us and talking about not only what's going on in Essex County, but why it's important for all of us to be aware and go to the right resources. EssexCountyNJ.org is the place to find out. Also, you're outside of Essex County, 99% of our audience is. Go to your local county website, find out what they're doing as well. Phil and Maya, thank you so much for joining us on Uncut.
thanks for having us.
Thanks for having us.
I'm Steve
Goodbye.
Adubato. Sorry, Maya, we'll be right back.